The federal Labor government has vowed to close the health gap between Indigenous and non-Indigenous Australians. The Close the Gap program aims to narrow the 17-year life expectancy gulf within a generation, which will also include trying to halve the Indigenous infant mortality rate by 2030. Prime Minister Kevin Rudd says there will be different opinions on how it can be achieved, but everyone has to be determined for it to work.
We have a rolling debate about how best to deliver services to Indigenous communities across the country, health services, education services and the rest. But unless you have a single galvanising, organising principle, which is we want to get to this endpoint, which is to close the obscene gap in life expectancy between Indigenous and non-Indigenous Australians, to close the obscenity of the gap between Indigenous children under the age of 5 and non-Indigenous children, and their health outcomes and their education outcomes. Unless you have those as your galvanising principles, then policy and government programs disappear in all sorts of different directions.
We've also worked to detail what needs to occur for this commitment to be met. And this involves complementary commitments to achieving equality of access to primary health care and health infrastructure within 10 years, and the establishment of benchmarks and targets for achieving equality of health status and life expectation, negotiated, and it has to be negotiated, with the full participation of Indigenous peoples.
Olympic legend Ian Thorpe says it's up to every Australian to help close the gap.
We have a moral responsibility to everyone in this country, and that includes Aboriginal people, and on that basis, this was the right thing to do. It's an important thing to do, and I'm glad that we've started to close the gap on this issue. And Catherine and I haven't done anything like this before. It's the first time we did this together, and we knew what a strong, powerful message this would send out there for Aboriginal people and non-Indigenous people in this country.
Through the Catherine Freeman Foundation, I've got a great team. Obviously, in the climate under Mr. Rudd's leadership, it's been fantastic. The timing's perfect, and what's so funny? But we're focusing on literacy and non-truancy projects. I've decided I want to focus on Indigenous young women, and I want to provide the best possible opportunities in which they can flourish and be the best that they can be. And in turn, like I am, is realising our own inner strengths and abilities.
Opposition leader Brendan Nelson and Olympic gold medalist Cathy Freeman have also signed the pledge, and Indigenous health workers and doctors welcome the commitment. In Canberra, Michael Kavanagh, Macquarie National News.